Hi, my name is Adria Thompson, and Carewell invited me today to talk about incontinence care with people with dementia. I am a speech-language pathologist, and I have over 8 years of experience providing one-on-one treatment with individuals with dementia. I am now also a dementia educator. I have extensive experience assessing someone's cognitive abilities and then implementing interventions that will keep them as safe, independent, and as happy for as long as possible. When individuals with dementia start experiencing confusion going to the bathroom, which then results in accidents, it can be a daunting experience, and nobody feels like they've quite signed up for that. So today I want to walk you through how incontinence is impacted by dementia, how we can make changes to meet their needs, and then I'm going to introduce you to some products that might be helpful on your journey. Dementia, according to the Alzheimer's Association, is a general term for loss of memory, thinking skills, problem solving, which is severe enough to impact function, and it interferes with their daily life. There are many types of dementia and different causes of dementia, but generally, dementia gets worse over time, and their brain is actually deteriorating. So not only do brain cells die, but the brain itself can grow smaller. So although we think about going to the bathroom as largely a physical task, it's actually a series of actions and thoughts that are pretty complicated. So we're going to break that down today. Okay, so let's pretend like you just woke up in the morning. I want you to close your eyes and imagine that. How do you feel? Do you have to go to the bathroom? You feel the need to urinate? That's not far from the truth most days, right? So how do you know? How do you know that's what is happening? You are experiencing a sensation in your abdomen, right? So, okay, what's next? You have to get out of the bed, right? So you muster up strength and coordination of your muscles in your arms, legs, and your core, and you sit up on the side of the bed. Now that you're sitting there, let's get oriented. You look around the room, and what do you see? How do you know where you are? You visually scan the room, and you see a couple of doors. But how do you know which one to go through? You use your memory of living in this place for several years, months at least, weeks maybe, and you know that the door to the left is what goes out into the hallway and the door to the right is the one that goes to the bathroom. That's a cognitive process that happens in a millisecond. Have you ever woke up in a hotel room and felt completely disoriented for just a few seconds trying to figure out where you are and which door goes to what thing? It's just an unfamiliar layout you're trying to figure out. So anyways, you figure it out. It's the door to the right. Once again, you have to use your physical strength and coordination to get yourself up off the side of the bed and standing. You move your body towards the door and you move your body to open the knob. And you see lots of items in this room. You see decor on the walls. You see bottles of shampoo and conditioner and lotion, soaps and perfumes and toothbrushes, and then a slightly disheveled but nice looking person staring back at you. But your brain doesn't allow you to be distracted by all of these things. And you decide you don't need to interact with that person in the mirror. It's you, after all. So you return your focus to the original plan, which is to find somewhere to relieve this feeling. And you see that white seat on the other side of the room and you recognize it as where you need to go. So you move your body in front of it and you identify the need to turn around and put your back to that white seat. You manage to push your clothing down and sit down. That cool feeling on the back of your legs is an indicator to your brain that now is the time to finally get that relief. It's complicated, right? That's for someone who doesn't have changes in their brain. Any confusion or difficulty in any step of that process can result in incontinence. So when individuals with dementia start to experience incontinence, we can't just automatically assume that there's a physical reason or just that they can't hold it anymore. Instead, it might be a memory, attention, proprioception, physical strength or coordination, attention issue. This is why incontinence is so complicated for people with dementia. So what can we do? We need to be good observers. As I went down the list of all of those experiences and all the things that we just so instinctively do when we go to the bathroom, we need to consider where the breakdown might be occurring. If the person is having physical difficulty just getting themselves to the bathroom and it's a recent change, we might want to consider getting a physical or occupational therapist involved. They can assess and treat someone for those kind of things. Are they having a difficult time finding the bathroom? Maybe we need to increase lighting or put a sign up next to the door that goes to the bathroom so that they're not wasting time looking for it. Are they getting distracted by objects in the environment or getting scared about the person in the mirror? If so, we might just need to simplify or remove those things from the environment. But here's the thing, we need backup. We might have all the right interventions in place, but yet incontinence still might happen. And as individuals age and they have other medical conditions, injuries might occur and their cognition declines. Even that way that we've thought about incontinence before as just being a physical, like they can't hold an issue, like that could become true for them. So having quality products is essential. So I want to introduce you to these Cardinal Health products. These are the Wings Adult Briefs. So a brief has tabs on the side, as you can see, and these usually require assistance in putting on because an individual with dementia might not be able to secure these on themselves. They are super absorbent and they neutralize unpleasant odors. And one really unique aspect of this product is Cardinal Health's signature Breathe Easy technology. Breathe Easy is a unique design that allows for a more comfortable, cooler experience for the person wearing it. This is important not just for comfort, but it keeps moisture away from the skin, decreasing the risk for skin breakdown and heat buildup. The cloth-like breathable back sheet doesn't give the plasticky feeling or sound like some other incontinence products will. Many individuals with dementia might wear one of these at nighttime, especially if they're incontinent while sleeping. It's really important that when you order a product like this is that you get the right size. The absorbency of these products are great, but they have to be hitting the person at all the right spots. If a product is too large or too small, it might cause leakage to occur. But in the worst case scenario, Cardinal Health has you covered there too. These are the Quilted Premium Comfort Underpads. These can be placed in someone's bed, in a recliner, in a couch, under them in the wheelchair to protect the surfaces from moisture and bacteria. They are the ultimate just-in-case product. These pads also act to pull moisture away from the skin and neutralize odors. One aspect I really love about these is that they are strong enough to be used as a draw sheet. So you can use these to assist a person in turning in bed for people up to 300 pounds. So that's a 2-in-1 product that really helps cut corners in those challenging moments as a caregiver. And finally, I want to introduce you to these SureCare Super Disposable Underwear. These are available in different absorbency levels as seen here on the front. This is the maximum. These are great for occasional incontinence or leakage during the day. They are also breathable and have a really great cloth-like fabric. When needing to assist someone in changing, the Easy Tear sides allow for quick changes. Because they pull on like regular underwear, there's no tabs that need to be adjusted. And size really matters for this product too. On the back of all Cardinal Health products and on the Carewell website, they have a sizing chart that tells you exactly what areas to measure for an individual and which products to purchase. If any of these products interest you, I encourage you to go to the Carewell website. You can now get 30% off of your first order when you sign up for auto ship, and 5% off for recurring orders when you shop Cardinal products. But if you continue to have questions about any of these incontinence products, Carewell has a support phone number 24 hours a day, 7 days a week, where you can discuss your questions and concerns. Also, please subscribe to Carewell here on YouTube for more valuable information on your caregiving journey.